Okay, so we're just going to now move on to a different topic and look at the liver shrinkage diet. This applies to the preceding weeks before your surgery date. There's a need to follow a specific diet to make sure that the liver is shrunk accordingly, and that is because most people will find that the livers are in an enlarged state. They might have a fatty liver, and that's going to hamper the ability of the surgeon to move that liver out of the way and proceed with the surgery. So with all the surgeries, this is required, and it's going to be a low calorie, low carbohydrate diet. So it's generally for around 2 weeks before surgery. It may be a little bit longer if the surgeon has requested this. Due to the position of the liver sitting over the top of the stomach, the surgeon said needs to move the liver out of the way and hold it out of position during surgery.
Here we can see on the left-hand side a photo of an enlarged liver with fatty deposits. The yellow material in the photo is intra-abdominal fat. The right-hand photo, on the other hand, is a clear liver after the liver reduction diet. The liver will be flexible and floppy with a clear edge, and this allows the surgeon to delicately move it out of position. You may also notice the reduced amount of intra-abdominal fat, which will help the surgeon with access.
So how is it undertaken? So at Chelsea Westminster here we use a couple of main options. One of them is a food plan, and the others is a meal replacement shake option. So as mentioned, it's a low calorie, low carbohydrate diet, and it will last for at least 2 weeks, possibly longer if the surgeon requests. So the first method with the food plan or the second method with the meal replacement shakes will both achieve the desired reduction in liver shrinkage if adhered to. Which one you choose depends on what you think will best suit you and really links into your previous experience. So if you've had good experience with meal replacement shakes in the past, you might want to give those a go first. Or if you'd miss the element of eating food, then you'd probably want to try the food plan first. We'll recommend a 1 week trial for everybody. So it doesn't matter what surgery you're having, you're required to do a trial. That's needed to prepare you for what's ahead and ensuring you have thought about any areas you might want to change for next time. So you ironed out anything that could potentially send you off track. It's going to give you that opportunity to reflect on what went well or what made it harder. Also, some people might like to repeat the trial as they go through the pathway or try the alternative option if they feel that the first one was a bit of a struggle.
So it's important to consider what would happen if you did not complete the liver reduction properly. So there would likely be less liver shrinkage and intra-abdominal fat loss, meaning surgery may be harder and take longer, resulting in more time under anaesthetic. The surgeon may decide that it is unsafe to continue due to a risk of bleeding and damage to the liver or surrounding organs. The surgeon would not know this until they start surgery, as a scan wouldn't be a reliable indicator. This would be distressing, a waste of your time and energy, a waste of the NHS resources, and likely mean waiting again for another surgery date. Overall, weight loss can generally be a good indicator of how well you have adhered to the diet, but this will be variable from person to person.
Okay, so that's an introduction to the liver reduction diet. We'll just think now about what you need to be doing to prepare for this ahead of time. So if you haven't started to think about this yet, make sure you've read the literature that you should have been given at your initial appointment. And then once you've discussed this with the dietitian in your next dietitian appointment, that's when you can think about starting a trial. So if you haven't discussed it with a dietitian yet, don't start a trial. Speak to them at your next appointment and they can plan out when that should be.